Don't worry, be happy, just breathe. Darlene, Mendia.
Don't worry, be happy, just breathe. How many of you experience stress? Problems at work? Maybe it's money difficulties, or traffic during rush hour, or you're fighting with a loved one, or you just didn't get enough sleep. How many of you would like to make your life less stressful? You can, by simply breathing. I'm going to teach all of you a breathing technique which can be used at any time, at any place, to help you relax. But first, let's talk a little about stress. Not all stress is bad. We all have a stress response, which can be life-saving in some situations. The nerve chemicals and hormones released during stressful times prepare us to face a threat or to flee to safety. When you face a dangerous situation, your pulse quickens, you breathe faster, your muscles get tense, your brain even uses more oxygen. These are all functions aimed at survival. However, when you feel chronic stress, high levels of stress for a long period of time, those same nerve chemicals that are life-saving can suppress important bodily functions. Your immunity is lowered. Your digestive, excretory, and reproductive system stops working normally. These health problems occur if the stress response goes on too long. This happens when the source of stress is constant. Today, in our fast-paced society, high levels of stress are common. According to the American Psychological Association, money, work, and the economy are the highest sources of stress for Americans. Family obligations and relationships are also reported as high sources of stress. There are many stress management techniques which are helpful in reducing stress-related symptoms. One valuable stress management technique is called diaphragmatic breathing, which is recognized by Harvard Medical School as an effective relaxation technique. Diaphragmatic breathing, also known as belly breathing, can help you reach a higher level of physical and mental relaxation. This breathing technique focuses on controlling breathing in order to clear the mind. Diaphragmatic breathing, belly breathing, has a positive influence on heart rate, blood pressure, and muscle tension. This rhythmic breathing decreases neural stimulation of muscle tension and organs, causing a sense of deep relaxation. The belly breathing technique can be performed anytime you feel tension, stress, or anxiety. Can someone please dim the lights? And can my volunteer please come up and have a seat in the chair in front of me? A little bit higher. A little bit higher. Thank you. Can everyone please stand up? Push your chairs back a few inches. Now sit back down. I'm going to teach every one of you how to belly breathe, how to relax. This exercise is performed best if you're lying down, but it can also be done if you're seated or standing. Is everyone comfortable?
Mhm.
Place one hand on your chest and one hand on your stomach. Relax your face, relax your neck, relax your shoulder muscles. Take a couple of normal breaths. Feel how your body feels. Now, try to take a slow, deep breath, expanding your stomach. Keep breathing through your stomach. Relax your chest. Breathe in. Breathe out. You should only feel the hand on your stomach moving up and down. The hand on your chest should not move. Breathe in slowly. Breathe out slowly. Breathe in slowly. Breathe out slowly. When performing this exercise, just keep breathing about 10 times until you feel relaxed. Next time you feel stressed, place your hand on your stomach and just breathe. Next time your boss at work is demanding too much from you, just place your hand on your stomach and just breathe. If we can all alleviate even a little bit of stress every day, we will all live happier and healthier lives. Don't worry, be happy, just breathe. Mr. Toastmaster?
You engage the audience immediately by asking a question, a very good tactic. Your objectives were to speak clearly, how to say it, and to avoid jargon. I didn't hear any jargon. I didn't hear any short letters ran together to tell us something. Everything was explained, and the flow was very smooth. You had a good opening. Your body supported the opening. And you engaged us as you went along with stepping in front of the podium, the lectern, and looking at the audience and engaging us. Your voice volume was such that I think about everybody could hear you. You need to remember to speak to the whole room. One thing I noticed at the beginning, you were a little soft. When you want to grab the audience, step up and get their attention and draw them in. And if they're really interested, they're going to keep listening to what you have to say. And we were interested. I looked around the room, everyone's eyes were riveted on you. Perhaps partly because you were speaking a bit softly, but the message was something we were all interested in. You asked, does anyone experience stress? Everybody's hands shot up. And then you gave us a way to cure that stress. You taught us how to use the two parts and how to recognize what was happening by using our hands to separate them and to make sure when we wanted to relax to do the belly breathing. The only improvement I could see was at the beginning a little bit louder. At the end, you were soft enough, but we were all focused on what you were saying. You had us relaxed. Everyone was sticking tight to every word you had to say. Your presentation was clear, good opening, good body. The closing supported the opening in the body. An excellent use of bringing everything together. Really enjoyed your speech, and I look forward to your next one.